Now, we are all extremely worried, not just for ourselves, but for our loved ones as well. And this is compounded for anyone with mental health conditions. So how do we best cope with these feelings and deal with potentially prolonged isolation in a situation that you can't control? We're going to talk now to Mould, who's a psychotherapist from Anxiety UK, and I'm also joined by Phoebe Brown. Phoebe is a PR manager in London who wrote an article about her health anxiety around coronavirus earlier this month. Michelle and Phoebe, welcome to both of you. Thank you so much for joining us today.
Thank you.
Phoebe, I'm going to begin with you because tell us about your health anxiety. When did it first start and how are you feeling specifically about this pandemic?
I've had it for as long as I can remember. Like I remember my first ever panic attack when I was about 11, I think. And that's, I had the same kind of worries when the swine flu was going on and same with the Ebola risks. So yeah, during this time, it's been quite hard for me and other people suffering similarly to rationalize how not to worry about a pandemic like this.
And what are the symptoms as well as your mental well-being, the stress on your mental well-being? Do you experience physical symptoms as well?
Yeah, physical symptoms can involve, panic attacks, which is probably the worst one, which you just feel this rise of panic. Some people cry, some people experience a shortness of breath. For me, I kind of feel a bit sick sometimes if I'm feeling particularly anxious, but it varies for different people.
Okay. Michelle, turning to you, your phone lines at Anxiety UK have been absolutely log-jammed, I know. The sort of thing that Phoebe is talking about, is that typically what people are saying to you when they ring up to talk about coronavirus?
Yes, absolutely. When we think of health anxiety, any ideas that we have on helping people with that are basically the same that we would have for general anxiety disorder. And so, yes, the anxiety, the panic attacks, this is all where we are feeling that we're under threat in some way, where the fight, flight and fright system comes into play. It's a survival instinct that we have as human beings. And of course, in actual fact, in most situations in our modern day lives, we're not under a real threat of losing our life, for example, in that instant. So it's where that system is kicking in through cues in our environment unnecessarily. And there are some very good coping strategies that any good therapist will be able to share with people that will help in those circumstances.
Okay, well, I'm going to ask you about those strategies in just a moment, but back to Phoebe first of all. Phoebe, specifically about coronavirus, because it is something that clearly is here in the UK. Cases are rising worldwide. How has that made you feel compared to other issues that you've had worries about? And have you been able to employ any sorts of strategies to help calm your feelings of nervousness?
This has been a particularly bad time. I think I've been panicking since about 2 months ago, when a lot of people were telling me to stop being ridiculous. Now I feel like everyone else is finally catching up with the same level of panic that I've been experiencing. But in terms of strategies, I think talking to other people, muting the words on Twitter as much as you can and not looking at the news sources, because I think it is the media are kind of, at least beforehand, were causing a bigger panic than was necessary. So I think avoiding those kind of sources and only reading the straight facts from places like Anxiety UK or from the NHS, I think listening to that advice is probably key. And yeah, talking to your friends as much as possible, keeping in touch with everyone.
And as I was just mentioning before we did this interview, the head of the NHS saying it's really important that people get trusted advice, accurate advice from trusted sources rather than look at misinformation that's out there on social media, etc. Michelle, back to you. Let's talk about those strategies then. What are the key general ways that you think people can help control any feelings of panic, anxiety, stress and worry over this virus?
Well, when we come to people who are feeling panicky, then something called our 7-11 breathing or calm breathing technique would be a first go-to. And when we think of that flight and fight and freeze system coming into play, our breathing changes so that we are breathing in more oxygen, and our in-breath is longer than our out-breath. And that's actually what sends signals to the brain saying that we need, that we're in a threatening situation. So something that we can do to counteract that is to change our breathing so that our out-breath is longer than the in-breath. So it's called 7-11 because you breathe in for 7 and you breathe out for 11. That's just a loose recommendation. I would always say to my clients to try 3 and 5 or 5 and 7, work out what feels best for you. But not only does it give us a signal to the brain saying that we're calm, because that's the kind of breathing that we do when we are resting and we're in a sort of a calm situation. It's also a distraction because we're counting.
What advice would you...
It gives us something to be in control.
Yeah. Sorry, Michelle, what advice would you give then to people who are self-isolating and maybe are on their own, or self-isolating as a group of people living in a house, whether it's flatmates, family and so on, and are struggling with that? What advice would you give there?
Well, I think really it's about trying not to let our thoughts wander into the future and start catastrophizing. So it's about being present in the moment. And it's also about finding things that we can do that are either useful things or enjoyable things within the home. But it's also about making sure that if there's lots of people together, perhaps there's a space in the house where you can get away from everybody else and have a little bit of your own time, because we're not used to being on top of each other as families for 24/7 for any number of days usually. So that might be something else to consider. But yeah, there's some very good information on the Anxiety UK's YouTube channel. They've been doing some live broadcasts, one of which was one that I did myself on mindfulness. So some of those exercises might be very useful to do. I totally agree with the other lady. I'm going to interrupt you there. Sorry, Michelle, we are running out of time, and I do want to ask Phoebe again, but thank you very much, because I was about to ask you for some direction where people could look for good advice. Phoebe, have you been staying in a lot, or have you managed to go out and about a little bit?
I have been staying in. Before I started working from home on Tuesday, as I'm sure a lot of people. But before that, when I was still going in, I was avoiding like public transport and stuff. So taking my bike where possible, staying in as much as I possibly can, which I think is what everyone should be doing. I think that's probably the best option.
Would you feel confident, though, to go to, say, the supermarket or a pharmacy?
I would, but I think I would be specifically careful about, making sure to wash my hands or potentially wearing gloves when I go there.
Okay, well, and that is very good advice. Phoebe, thank you so much. Phoebe Brown and Michelle Mould, psychotherapist with Anxiety UK, with some really good advice. Thank you both again.